Next up, we're going to bring Netta back up to moderate this excellent panel.
Great, thank you, Tarek, and looking forward to this panel discussion today. Welcoming back Razu Stratza, Chief Strategy Officer and Executive Vice President at Atrium Health and a dear partner of ours at Plug and Play, as well as Damon Hemmerdinger, Co-President at ATCO Placemaker and Chief Developer, Camp North End. Welcome both to the panel discussion, and thank you so much for joining us. Maybe we can start off with a quick introduction from both of you, just regarding your role and where you are, and also a fun fact that wasn't in our prep, but what kind of hobbies maybe you've developed during COVID-19 and shelter in place.
Great, Netta. Well, I'll go first. It's an absolute pleasure to be here virtually in front of all of you, talking about such an important topic, right? So as we contemplate not just everything that we've gone through, but also what's ahead in front of us, and look at reopening the economy. The elements of both healthcare and education and retail, all three of these are so important. So just as a matter of background, as was mentioned earlier, I'm the Chief Strategy and Transformation Officer here at Atrium Health. We're the largest health system in the region here, with about 50 hospitals, 70,000 teammates. We're about an $11 billion health system. But more than the size, it's really the impact that we're having across the Southeast in terms of the communities that we serve and the gaps in care that we're really trying to address, even in the midst of the pandemic that we're in the middle of. And it's been a pleasure. I've been part of the Charlotte economy, the Charlotte community here now for a little over a year. I moved in from Pittsburgh and came to sunnier Charlotte. Netta, the one thing I guess from a fun fact perspective that I've kept myself busy with, besides family and my two kids who are looking forward to school perhaps reopening, although reopening in a new way, is gardening. I've taken up gardening, and it's amazing how I draw analogies to gardening and what we do on a day in, day out basis in terms of strategy and transformation. It's about providing sunlight. It's about fertilizing what you plant. It's about making sure that you're able to weed out things that you perhaps don't need, and then hopefully reap the fruits of your labor at some point. But I've really enjoyed gardening. It's provided a little bit of an outlet, a creative outlet, one would say, to an otherwise really taxing several months that seemed like at least a couple of years through the pandemic that we're living through.
Great, thank you, Razu. And I know a lot of people, gardening has been an area. I know some folks that are starting to get their own produce from their garden as well. So definitely a great one to add to the list. And with that, I'll pass it over to Damien.
Hi, thanks for having me today. It's a pleasure to be here to talk about very important issues with all of you, both from Charlotte and from the rest of the US and beyond. I'm the developer of a project in Charlotte called Camp North End. It's a large adaptive reuse of an old Army base just outside of Charlotte's Central Business District. And I'm a landlord as well in New York City, primarily in office and retail landlords. I'm looking forward to our conversation today about very important issues that are moving very quickly. I've spent a lot of the last 100 and whatever days in my house jigsaw puzzling with one of my daughters, which was definitely not something I ever invested time in before, but we're having a hard time keeping up with enough puzzles to keep her going. So it's been a fun distraction from much more intense and stressful things to think about.
Excellent. Thank you so much. Thank you both, and looking forward to diving right into the panel discussion. And I know we have great different perspectives here on how, from a real estate perspective, we're getting affected, as well as more from a healthcare perspective and healthcare innovation. So looking forward to the discussion here, and feel free to make it as interactive, as you'd like as well. Would love to jump right into understanding from both of you around the topics of COVID-19 and how it's affected, your day-to-day, as well as how you believe it'll impact the future of your prospective industries.
Yeah, so I'll just jump in here. When you look at something as dire as what we're living through, which is the pandemic, the numbers themselves are just so baffling, right? Today, we have upwards of 144,000 deaths in the United States, with close to 4 million confirmed cases. So just think about that. Nearly a quarter of the world's deaths right here in the United States because of COVID-19, and we're a country that has less than 5% of the world's population. So it weighs heavily on us as a health system. And look at the entirety of the ecosystem that we live in. One of the things that we've quickly come to realize is that it definitely is very different, right? So the future is not going to be what it used to be, and we're quickly coming to realize that because of what I've been calling the trifecta of punches that we've been living through even in the last 4 months or so. One obviously is the pandemic itself and how it's affecting our patients, our communities, and even us as a health system and as an industry. The second is the economic ramifications of the pandemic because of both the health effects as well as the economic closure, everything else that we've been dealing through. And I think that weighs really heavily in terms of the conversation that we're having, including around real estate, including around the space and how we redesign the reemergence of these businesses that will flourish again. And then the third element really is sort of the societal impact, right? With what we've been living through even in the last several weeks around the racial inequities and the societal impact. And that's something that, here out of the Southeast and particularly in Charlotte, I've been paying a lot of attention to. We as a health system have been really focusing in on the gaps between the haves and the have-nots. Charlotte is, from a financial perspective, the second largest financial hub in the country, right after New York. But Charlotte also is, out of the top 50 metropolitan cities in the United States, number 50 when it comes to upward mobility. Meaning, if you're born poor in the Charlotte region, chances are you're going to remain poor. So those gaps that exist between the haves and the have-nots in many ways is emblematic of what's wrong with healthcare in the United States. So we're really motivated to close those gaps. And the trifecta of those punches that I mentioned earlier, they're all related, right? The race issues, the economic issues, the issues that we're dealing with from the pandemic itself, they're all really, really related. So we've been pushing ahead with lots of innovative solutions around it, but we're also excited about, where are we taking all of this and where's this all going? And we'll get an opportunity to talk more about this in our discussion today.
Excellent, thank you. And Damien, I know I've learned more about Camp Norton and the comparison to I think Station F is something that is very close to it. And I know Station F has had a lot of trouble in addition to other co-working spaces, and they have a restaurant and everything else that comes with it. When it comes to reopening and kind of being able to reopen safely, but being in development and not being fully open, I'd be curious to also hear if you guys are thinking of any changes like structurally or changes in like conference rooms and setup to kind of, be able to accommodate some of the latest changes we've gone through.
Sure, that's helpful. It's hard to follow a healthcare conversation and portray what we're talking about is important, because obviously at the moment, keeping people healthy and alive needs to be all of our top priority. But in this time of kind of radical transformation, there's been really an amazing burst of creativity in terms of how to think about using space differently. Typically in retail, pivoting, or in real estate, retail and otherwise, pivoting takes a very long time. You have to design something, you have to permit it, you have to buy it and build it, and so forth. And each of those pivots is an expensive investment of capital. So what we've really seen so far is tactical interventions or kind of guerrilla urbanism, things that range from pieces of plastic or shower curtains hanging between a sales clerk and the customer, regulatory changes, letting more outdoor dining take place, and kind of everything in between. I think it's still not a clear picture of to what extent the way people are using space now will persist after we either have a widely distributed vaccine and or herd immunity or whatever happens after this period, when we're into whatever the future is. I think humans are very social, and I think there'll be a return back towards the mean, where people will want to eat dinner together in a restaurant, will want to go to a movie in a movie theater, even though they can watch it at home. But it will take some time to get there, and it's not clear, frankly, what sets of businesses will be able to make it through that period to be coming out the other side. In terms of the question you asked, we're fortunate because the layout of our project actually aligns well with some of the COVID priorities. That's frankly more luck than anything else, because we weren't thinking about those kinds of issues. But a space where you can have a large office without going through a lobby or without riding an elevator, where each business has their own restrooms, where there are multiple points of ingress and egress to a space, covered outdoor space to work, with and on and on. So we haven't had to radically pivot what we're doing, but we certainly are changing the way we think about bringing people to our site for programming and events, and trying to facilitate the operators of restaurants and other businesses on site to adapt to the reality.
Great, thank you. And it's great to hear both, perspectives as well. I know in several of the sessions I've been in, we've covered more healthcare as well as other areas in enterprise and kind of the future of work and how we've had to adapt. But it's great to see kind of the healthcare and real estate perspective. Maybe diving into how both of you, but maybe more specifically, Razu, around how you've responded to the crisis and how you've had to, set direction, align strategy, and really determine what are the immediate priorities versus, some more long-term.
Well, thank you for that question, Neda. As I mentioned earlier, it is such a grave situation to find ourselves in. As Damon mentioned, this is not what we were preparing ourselves to get into in 2020, but here we are. And it's interesting from an immediate response perspective. We thought about it as, all right, we got to jump to the occasion. We talk about how we should never let a good crisis go to waste. But quite seriously, I think what COVID has done is it's been able to shine a light on the cracks and the fault lines that already existed in the delivery of healthcare, in the communities that we're a part of. Because healthcare isn't just about sick care, right? Healthcare isn't just about curing someone from an illness. And that's something that Atrium Health is really, really focused in on, is sort of the whole person care, making sure that we're able to focus in on wellness and thriving as opposed to just surviving. And that's talking about the communities that we live in, those spaces that Damon's talking about. And that's been a big focus areas for us. So shining a light on both the cracks and the fault lines that exist already, but also it's shining a light on the muscles that we knew we had, or perhaps did not know that we had. And that's where I think from a health system perspective and the work that we're doing with our communities, we've really been able to rise to the challenge. And I'll point out three quick things. One is really serving our patients and communities. And that's one thing that we've really been able to do well, I think, you know, whether it's turning on our AI-powered chatbot within days back in the early part of March, whether it's coming up with really innovative care models like our virtual hospital model that kept patients out of the ICU beds and were able to really care for them in an environment that they were familiar with, which is their homes. Whether it's turning on our virtual care services, you know, we saw an immediate bump up in the video visits, 7,500% bump up in video visits. It was just remarkable. And then tremendous research and clinical work, research around antibody studies and therapeutics and vaccines, a lot of work around data and analytics. So really serving our patients and communities was one. Second is really closing the gaps in care. And I mentioned earlier the haves and the have-nots. And focusing in on the social inequities that, you know, exist in our region here. An example of that is we noticed earlier on where you know, specific communities where we had African American folks in our communities, the Latino populations, they were not getting the level of testing. And we're able to, you know, really analyze all of that, leveraging GIS capabilities and hotspotting capabilities, and immediately deploy our mobile testing capabilities to those zip codes, and got it to a point where we actually had a parity in zip codes in terms of you know, the testing capabilities across the regions that we're serving here. So really proud of that. And then last but not least, you know, focusing in on the reopening of the economy, because that's really important, and doing this in a really safe and intelligent manner. And we pioneered what we call our COVID safe approach to opening up our facilities. And that's something that we've been working with other larger employers and partners in the region as well, where we've been working with them and lending to them the approaches that we've perfected here around our COVID safe approaches, and doing this in a safe manner, in an innovative way, making sure that we're able to turn back to the communities. And in doing so, as we're reopening the economy, also then strategically focusing in on the economic resurgence that I know, that I'm confident that we're going to enjoy in the Southeast here, spurred from the greater Charlotte market here.
Thank you, Rezu. And I recall in the years that we've worked together, and also in Charlotte in particular, that the topic of social determinants of health is a big area. And, you know, everything that you described of, you know, the way that you look at healthcare and the way that you look at your patients as a whole person, you know, you are looking at everything that creates the best, you know, social and physical environment for them to promote, you know, good health. And maybe just to also include Damien, I'd be curious maybe how we can tie in more, you know, real estate and housing, because that is one of the pillars of, you know, social determinants of health, into this discussion on, you know, what adjustments are perhaps being made there. I know, you know, we're in a different place here, but there are, you know, some changes being made on the housing front, but would love to also hear your perspective.
Sure. I think another area where we frankly were lucky was our decision to use a scoring rubric called Fitwell as a way to think about the work we were doing in making, weighing options of where to invest capital in our project. Fitwell, you might have heard of LEED or other environmental rating systems for real estate, for buildings. Fitwell is a different one of those that focuses on how to use a building to improve occupant health, wellness, and creativity in the space. And so by a mixture of things that are real physical choices, as well as choices that nudge employee behavior in one way, or occupant behavior in one way or or another. And I think, and that's it. So in part through that, we've learned about tremendous amounts of research that have been done over years and years by the Center for Active Design, which runs this program. And it was actually started by the federal government and the CDC years ago. But so these groups have been researching for years how the built environment impacts physical health, mental health, and emotional health, in terms of things like your ability to see trees, your ability to walk to transit, your ability to walk to other destinations. And I think those priorities will continue. So in a multifamily building, separately from the financing structure that lets one group of people afford to live there or not, which is obviously absolutely critical to solving the question you asked. Beyond that, I think what's interesting to think about is that there are choices one can make within the design and construction process, and then also in the operations of a place, of a building, that can really have positive impacts long-term on people's ability to function as healthy, sane, and people who are at peace. And that ultimately helps people live happy and successful lives.
Hey, Damon, let me chime in real quick. We have an attendee question, and I know you well enough to know that you can handle a good curveball. One of the purposes of this is obviously not just get the key opinion leaders' perspective, but also share things you've seen that they can do and be involved in. This question is, have you seen any innovative solutions that restaurants or other retail stores have implemented in order to safely operate during COVID-19? I mean, you've just, inside the last 4 months, I've been at a ribbon cutting socially distanced of some of your retail shops in Camp North End. What is there anything that jumps to your mind when you hear that question?
I think it's a great question. I think there's lots of innovation. I think we're very, very lucky that this happened in the spring and that we're coming out of it into the summer, because a lot of that creativity is taking advantage of people being able to be outside, which will be harder in December than it is in July. So I think conversion of parking spaces and outdoor dining to allow diners to be healthy. I've seen restaurants that have eliminated a printed menu and have printed a QR code onto their placemat so that you can take your own phone and scan it and see the menu on your device. I think kind of the conversion of stores into distribution centers and curbside pickup has been an amazing kind of feat of logistics that's allowed sales or employees to be inside a space without having to be in contact with customers, and customers to pull up and purchase something while staying outdoors. There are also some fun things I'll just mention. One, there's a restaurant in Amsterdam that I've seen pictures of in the news that built little plexiglass, almost like Santa huts that they've built outside along the edge of the canal that is in front of this restaurant. And so you sit in your little hut by yourself as a party coming for dinner, and they actually pass your food in on a pizza paddle so that people can stay away. So that's pretty hard to replicate at large scale, I think, but that's an example of where people with creativity and needs are kind of pushing the envelope, and it'd be fun to see which of those kinds of innovations sticks.
Great, thank you. Thank you so much. And I know there are some movie theaters coming on, whether it's water, the ocean or wherever it may be, but little boats and outdoor movie theaters as well. And I know that was something that started in Europe, but we'll be having one here in San Francisco as well, which will be quite cold, but will be fun to hear how that goes as well. Maybe just transitioning, I really liked, this question, and would love to maybe go into this and then go into kind of moving forward. But what are still some challenges that you both see, and specifically more maybe on the healthcare side? Are there, this is a big question, but any areas where you feel you still haven't solved those challenges, and what would you recommend to other major healthcare organizations right now in terms of innovation?
Yeah, I'll take a quick pass on that one, Neda. So if you think about, just even the conversation that we're having right now, on the spaces issue, on the real estate issue, on the housing issue, it's atypical for a health system to prescribe affordable housing, but that's essentially what we've been doing at Atrium Health. So Atrium was really first out of the gate to prescribe affordable housing, and we committed to $10 million towards affordable housing in the recent past, and that's something that we're really proud of, and working with multiple other partners in the Charlotte community to drive forward. And what's really interesting is, in light of the pandemic, the lens that we're looking at in terms of those spaces that we're talking about, from an innovation perspective, we're really thinking about what does it mean for waiting rooms, right? Waiting room is a space that you have, whether it's in your doctor's office or in your EDs or urgent care visits and such. And how do we leverage technologies, capabilities around virtual and some of the digital elements to perhaps even get rid of waiting rooms altogether, or at least streamline or minimize the wait and the interactions that you might have outside of the interactions perhaps with your care team, which you can again optimize leveraging digital and start from home, from the comfort of your smartphone in your pockets. So lots of different elements of space and redesign. But I also want to put on my innovation hat, and from an investment innovation, healthcare transformation perspective, the one thing that I'm really excited about, even in this panel, is with Damon and all the cool work that he's doing around spaces, for us to really make sure that we're able to co-create spaces that allow for these points of intersections between healthcare workers and entrepreneurs, those in the startup community, and others that live and work in those communities as well. And I think that's really important, not just in creating cool spaces, but functional spaces that allow for those points of intersection. So we're able to really think outside of the box. We're able to really exchange ideas. And that's something that we're really excited about at Atrium as well, is, as we rethink medical education, as we, talk about and pull plans together around building what I believe will be the most innovative medical school right out of Charlotte here. We're talking about these spaces, we're talking about an ecosystem play, not just of healthcare, but of retail, of entrepreneurs, of investors, and technology folks really coming together so that we can create the next thriving economy right out of the Charlotte market.
Quick follow-up for you, Razu, if you don't mind. And this is not just for what you would say to other healthcare providers, but really anyone out there that's business model, that what they're doing, their activity is not just maybe, and no offense, Damon, it's some ways, some might classify some of the retail things as a nice to have, right? And the nice to have is important for those who are trying to save their business and execute. But I think my question to you is, what about those businesses that have some angle of a need to have during a crisis, during a pandemic like yours? I think that must add an entirely another dimension to it. And so for anyone out there, healthcare or otherwise, you've sat through the last 4 months in both trying to figure out the nice to have pieces of what you do, but also the need to haves. How do you go about prioritizing your focus, right? How do you go about, because you told me yesterday, I think I heard you say 1,007% increase in digital interactions, right? Like that's probably something that needed to happen, but that doesn't happen overnight and easy, versus the affordable housing thing, which is obviously a longer term effort, but an immediate impact, absolutely doubled down on here. So any final advice that you might give to folks that are in that need to have environment and how to prioritize?
Yeah, so I'll talk about two quick things. One is really, think broad, right? Widen your aperture. I think that's really important. And we in healthcare have been so focused on the medicine elements, the sick care elements. And one thing that COVID has really, shown a light on is the fact that the walls between medicine and public health have really come down. So us working with the county, with the state, and with the federal agencies, even Secretary Azar was here visiting Atrium Health recently, and those are the conversations that we're having, so widen the aperture. The second is, I think, really, from a strategy perspective, the way that we've been approaching this is what we call a bimodal approach, right? Mode one, focusing in on optimizing what's predictable and what's understood and reactivating the economy and making sure that we're able to do this in a COVID safe manner. And mode two is exploratory. It's maybe looking at solving for some of the uncertainty, but also then throwing, wider bets out there, the reimagining, the exploration elements. And I think it's important to not do mode one first and then wait for it to be done before you move on to mode two. Approach it both simultaneously, and that's essentially what we're doing here as well. So I think there's a method to the madness. There's a strategic way that you can actually approach this, even as we're living through a pandemic.
Thank you, Razu. And sounds like great recommendation for everyone, both in healthcare as well as outside healthcare. Maybe just to wrap up, if Damien, any thoughts on similarly, like, long-term versus short-term, any recommendations for, the audience on the need to have, areas?
Sure. And Tarek, I agree that for certain aspects of retail and restaurants and so on are nice to have, but our system has so little slack and so little cushion in it that we have to remember, and I know you know this, that those nice to have businesses are providing huge numbers of employment to people who desperately need those jobs, and that without all of our staying focused both on our own businesses but also on pressuring our larger political community to find ways to soften the landing for people as those nice to have businesses fold, and before there's time for the new must-have solution to come online and start hiring people, we really are just at risk for human tragedy kind of at a scale we certainly haven't had in my lifetime in the US at the very least. I think Rasu's thought of widening your field of focus is a great one. And I think trying to stay focused both on solving today's tactical issues where you can, as well as trying to figure out what really is going to stick around as a long-term challenge or change, what's really a long-term structural change and that we need to plan ahead for, and what's going to revert back where we're just bridging over a problem. Those are things I think that everybody needs to wrestle with as they go through their days.
Great, thank you both. I know we didn't get to one topic, but we actually have a great event coming up around that August 5th around mental health and loneliness and how to kind of cope through personally during COVID-19. And so I invite everyone to join us for that session, and hopefully we'll have some of you back and participating there as well. But maybe just to wrap up, just to touch on that subject, just because it is an important one, any final thoughts or recommendations that both of you have for people around that subject on how to kind of cope personally through COVID-19?
Damon, do you want to go first?
I think we're all struggling and having good weeks and bad weeks. And I think remembering that when you're having a bad week, somebody else just had one, and probably somebody else can help pick you up and get you through that bad week is something always to remember. Both reaching out to help other people and reaching out yourself when you're in need to find somebody to help you pull through is just critical.
I agree with that. What's really striking about loneliness is that we were already in the midst of a loneliness epidemic in the United States. When we talk about our senior populations, when we talk about our frail and elderly, when we talk about just populations in general even. So we were in the midst of a loneliness epidemic when we got hit with this pandemic. And so the reality of what you're talking about here, Neda, is so true. And I think it's really important for us to, really up our game when it comes to mental health And that's something that we're pushing ahead with through innovative solutions, leveraging virtual behavioral health and tying it directly into the environments that our patients and our consumers and our communities can easily access. But then the other element too is just from a personal basis, I think this is the time for us to really rise to the occasion and use the opportunity, the silver lining, as was mentioned earlier, to connect, right? Connect with your family, connect with your loved ones, and do what we do best. And we in healthcare like to serve. That's the mission of Atrium Health, is to really serve our communities, the health, hope, and healing for all. And I think, there's no better time than now to serve and to connect with fellow human beings and use this pandemic that we're in the midst of as an opportunity to reconnect back with what matters most, which is really the relationship elements of living and life.
Excellent. Well, thank you so much both for this fruitful discussion, and I think several takeaways for everyone, both personally and professionally. Connecting with people and connecting with people throughout this process is something that I've also found to be quite prevalent, especially whether it's colleagues or friends or family. A lot of FaceTimes and check-ins with people as well. So really appreciate both of you joining us today, and looking forward to continuing the discussion and transitioning more to the education side. And with that, I'll pass it over to Tarek. Thank you.
Thank you, Netta, for that great work moderating. Thank you both for joining. That was a real treat.